You need something?
Yeah. Do you have a lighter, maybe? Lighter?
Okay, let's see.
Do you? No, that's not a lighter, Heidi. Do you have a lighter?
For cigarettes?
Yeah.
No.
No?
No, I don't have a lighter. Sorry.
Okay.
All right.
Well, hello class. And today we will be talking about Alzheimer's disease and COPD. So the skit that we just enacted was Heidi supposed to be telling me, hey, you have to have a lighter. And she didn't know what a lighter was. She was giving me keys, giving me tissue, giving me everything but what I needed, which is something that people with that disease will go through. And then we did a lighter because of COPD, which involves smoking, which is something that if you're doing, please bring it to a halt if you like life and breath.
That's right.
Okay.
So we're going to start out with discussing COPD, which is chronic obstructive pulmonary disease. And
Okay, so COPD affects over 3 million people, they say, yearly. It's a disease where, well, it's not a disease, but it involves like coughing, wheezing, and it's effects of smoking cigarettes. But I like to just say smoking anything, period. Some people smoke marijuana, some people do cigarettes, some people chew tobacco. Whatever your preference is, it all can lead to COPD. And it's not an immediate effect. It's one of those, like, the longer time progresses. You know, one of those things that's, if you can avoid stopping, it should be something that you should do because there is no cure for it. It's no like, you know, take this and you're good, or this many months and you should be fine. No, it's one of those things that, well, it's like a silent killer almost, because.
And there are other things that besides smoking, it's rare, but in my family, my mom and my grandmother both had it, and neither one of them had ever smoked. So it could sometimes be like pollution and some like environmental things. Sometimes like rates, depending on where you live, could be worse. Or if you're around secondhand smoke, anything that affects your lungs can get in there and cause that.
Or like if your family's working like factories, stuff like that, smoke inhalation. My granddad got lung cancer from working at the mill, the paper mill. So any type of smoke, it's best to wear protective gear, maybe like a mask or something, wrap your face up. Let's not just blow it off like it's small, because nothing really is small until it becomes something bigger.
Yep. And so now Diamond is going to talk to us about our second point, which is Alzheimer's. Our second disease, which is Alzheimer's.
Does anyone in the audience have a family member that's been affected by Alzheimer's disease? So have I. A couple of family members. It starts with like memory loss, and then you can start like people can become angry, not wanting to be around family, not remembering things that they should be. It could be something as small as, is this my home? Or, you know, recalling things in their childhood and forgetting things that are currently going on. So my great-grandmother was affected by Alzheimer's disease. She got it when she was about 80. She died maybe 3 years after that. But it started with her not remembering. She didn't know who her kids were. And it's a small town. She lived in Otagoville. So not so far out from Prattville, but it's right outside of Prattville. Diagnosed, and it was really tough on our family. It can be really tough on the family because it really does change your day to day. I don't know what I did with my car.
Yeah, but here, I'm sorry, I took them.
Well, no, but I said that Alzheimer's disease can be stressful on the family because time is of the essence. Once you find out that someone has Alzheimer's, you want to get them cared for immediately, whatever treatment that it may cost. Also, it's isolation on the individual who has it. They can feel lonely or feel like they know that something's wrong, but to know that something's wrong and be helpless is even more scarier for the individual. And I also said that it increases medical needs. You have to have doctor's visits, you need treatments, but someone has to take that individual to it, so that's wear on the family. Well, who's gonna do it? Well, I don't have time. Well, I still have to go to work. Well, this, that, and the third. They need 24-hour care. At that point, I just feel like when people get diseases, they're like, has anyone heard the saying, once an adult, twice a child? Yeah, that's what it is. Because that's like a baby. Now you have to do everything for it. It's definitely, and it costs. It's financial hardships. It takes money. Nothing in life is free. Nothing. So if you don't have the funds, then they can go without. And then that makes it worse because the longer it doesn't get better if you don't have the money to pay for these things. It's a loss of freedom for family as well because now you're tied to this individual every day. It's a daily job. It's round the clock. As I also said, feelings of loss or grief. If you lose your loved one, yeah, that's hard on the family, but it's also I won't say a relief, but it is a weight lifted off your shoulder because, you know, if you're not prepared, it can go wrong or it can go right. You know, it's a big adjustment. So once you're adjusted and then you lose them, you know, then you're dealing with just coming back to what you consider to be your usual self, and that could take time. So that was Alzheimer's disease.
All right, and now I'm gonna talk about Hashimoto's. So Hashimoto's is actually an autoimmune disease. An autoimmune disease that affects nearly every single body system or organ and system. It's associated with a malfunction of the immune system, which causes it to attack its own body tissue and stuff. So one of the autoimmune diseases, what I'm talking about, Hashimoto's. It's also known as chronic lymphocytic thyroiditis. And it turns the tissues against its own self. It also, the biggest part of it is it affects your thyroid gland. And it causes it to malfunction and not to produce enough of the hormone that you need for everything to function. And so the exact cause is not known, but there's some thoughts on it. These things might affect genetic, hormones, excessive iodine in your body, radiation exposure. So genetics, that's one for me because my mom and my sister and some of my aunts have it. Hormones, that's just saying it mostly affects women. Some men can get Hashimoto's, but mostly affects women. And then some symptoms are there's so many symptoms, and I will say that every single one of these has been a situation with me. Weight gain, fatigue, paleness and puffiness in your face, joint and muscle pain, constipation, hair loss, depression, slowed heart rate, difficulty getting pregnant, and then also feeling cold all the time. So the doctors didn't discover mine until I lost 3 pregnancies. And so that's when they did blood work and discovered that I had it. And when they called me actually back for another test because they thought something was wrong with the lab because the number was so unbelievably crazy. And so I had been struggling with it a long time. It explained probably a lot of the miscarriages and stuff like that. So the thyroid is located in the front of your neck. You probably all know that. It's like a little butterfly gland, and it makes the hormones are all responsible for metabolism, which is why a lot of people have some weight issues. It also affects your heart rate and how quickly your body uses your calories from your foods. So, okay. That's why some people with the Hashimoto's or thyroid problems, you could have so you'd be overweight and things like that. But for treatment, like I said, there's no cure, but you can improve it with lifestyle changes and managing the symptoms. Diet, weight changes, lifestyle changes will all improve it. As far as the biggest treatment is medication. The thing about medication is there are a few factors that, let me see where I put that. I remember there's a few factors that affects what the dosage of the Synthroid that they give you are, and your age, your weight, your previous health problems, and what medications you're currently on, and how severe your disease is. So from the time I was diagnosed until right now, which has been about 17 years, I've been on numerous different doses, and every 3 months you have to go get blood work, because if your weight fluctuates, it's a difference in a dose. It's one of the medications with the biggest span of dosages, because it's making a synthetic hormone for your body, because your body doesn't make the normal ones, and it has to get it just right. So we hope that we've enlightened you with any of these, with any of this, and kind of helped explain some of these things to you.
Yeah, any questions?